I'm Claudine Wong with KTVU, joining you from the San Francisco Bay Area, and happy to once again be joined by Katherine Wilson, who's coming to us from Rome, Italy, and Anna Wilson, who is coming to us from New York City. And we always have these conversations, which are fantastic because they give us so much perspective. We started these conversations months and months ago when things were terrible in Italy, Katherine, and then we kind of continued our conversations as things were terrible in New York City. And now here I am in California, where I think our situation is the worst one of the three. So how are you guys doing these days?
Well, Italy is, as always, I feel a little bit wary saying it, but it's really life back to normal pre-pandemic in the sense that pretty much everything is open. I mean, Italy in the summer is outside, so restaurants are not indoors full capacity, but they wouldn't be full capacity indoors anyway in the summertime in Italy. So, but people are traveling mostly nationally, but some people within Europe, and the numbers are still low. So, there's a good bit of optimism. Obviously, seeing what's happened in Barcelona and seeing what's happened in other places in the world, we know that the other shoe could drop at any second. So it's sort of a cautious summer. But I have to say, I mean, I think it was handled I don't know if there's a best way, but it was handled in a way that we got to the point that there was pretty much zero infection. So from there, you can start the sort of whack-a-mole for the clusters and figure out with lots of testing where those cases are and try to keep them as low as possible.
Yeah, so let me ask you this before we move on to how things are in New York City, which I think, we have to talk about the situation there because they're a little bit behind, as we've always kind of said, between the three of us, in terms of where we are in this, in this timeline. But when you say things are kind of back to normal, I mean, what does that mean in terms of people getting together, people, traveling within the area or short term versus through Europe and small groups getting together, et cetera?
Well, I would say big groups are still being disbanded by the police. So, for example, there was a big piazza in Rome where all of the real problem is the sort of 18 to 30-year-olds, which I think is pretty common internationally. They're the ones who are out and partying and wanting to be together, understandably. And so there are piazzas where there's too much of that happening. And so the police will come and disband those sort of situations. But people are going to other people's homes. Masks are worn inside places, but usually outdoors, not as much. And a lot of people are at the beach. So the beaches have laws about how far apart people need to be. Those aren't always respected, I have to say. But as I said, Italy in the summer is so much outside anyway that's, I think the biggest difference is that the mask, it was never sort of politicized in Italy. So it was like, here are the
everyone's wearing them and no one seems to think otherwise.
Yeah, people are wearing them, and then people who don't wear them, there's not a sense, there's like, oh, he must have forgotten his mask at home, like.
So what percentage? Yeah. What percentage of people aren't wearing masks?
Do you mean indoor, like inside?
Or inside and where they're required to? I mean,
close to zero. To zero. I'm in Rome. So pretty much everybody, when they go inside, they'll put a mask on. In restaurants and in the coffee bars, they'll have the mask on the chin as they, consume, and then the mask will go back on. That's Rome. I know that other places in Italy where there is still a zero infection rate, it's a bit more liberal and people are not wearing masks quite as much. Okay. But here indoors, masks are worn.
So I always like to pull this up, and this is our map again. And I remember when we were talking and Italy was way up here. Of course, now it's the US who is leading the numbers. You still have 35,000 deaths in Italy, but again, your trend is going in the direction.
Exactly. We were all those deaths because we didn't know the virus. I mean, we were the first, and all of those deaths were also because they were being spread in hospitals. and nobody knew what was going on. And a lot was done trying to help these sick patients, but not knowing that they were actually infecting the doctors, infecting the other people in the emergency room, because we didn't know. And I remember even, Cuomo in New York saying, if we don't do this, we're going to end up like Italy. I mean, Italy was
Yes.
sort of the worst case scenario.
Italy was held up. Let's go pull up the U.S. map so we can talk to Anna and see. I mean, New York now is being held up. It was held up as the place of saying, this is not where we don't want to be like New York. And New York was where I was interviewing all the doctors saying, this is this terrible, space in terms of capacity and fear. And it was a tough bet. And now, I mean, you can see over on the left side of the screen, you can see Los Angeles is the one that is at the top. And I know, here in California, Southern California is really, really having a tough time. I mean, the entire state is having a tough time, but Anna, how have things changed, in New York City?
Well, it's definitely gotten better, and we can eat outside now in restaurants. Almost every restaurant has outdoor seating, and we can, people wear masks outside even, and people come through the parks and give you free masks. And I just feel really lucky that we had leadership, that it just becomes more and more apparent how important it is to have a leader who can, which Cuomo was and is, to be able to put down some rules for people.
And certainly we've seen him traveling around talking to other state leaders now, trying to share the experience in terms of what needs to happen. Was there a sense, because I've talked to some people in other communities, right, where in the beginning, certainly there was a ton of pushback. Is this too much? Is this too? And now, I was specifically talking to someone in Maryland who was saying, and now they're the hero, right, because our cases are low. Cuomo, I think, saw that same, where people are like, is this too much? Is this too much? Even though it was so scary because what you guys had going on. But now, as you are held up in this place of look at what we're doing, do you find that the more people are looking, saying all of that had to be the example that people followed?
Yeah, I mean, because he was always referring to science. It wasn't like, I mean, the basic philosophy was better safe than sorry. Mm-hmm. And this is not that much we're asking of you to stay inside, wear masks, versus, putting people at lethal danger.
Do you feel like, I mean, in terms of how people emotionally are feeling too, like, I think the hard part in California is that it was really strict here, at least in the Bay Area, in the San Francisco Bay Area. We were probably the first to shut down, and we were, in terms of really, even though we didn't have a lot of cases, and then it started to open up. And now the hard part in California is taking some of these things back while trying to give some other, and it really has put people on an emotional roller coaster in terms of, even if they know they should go back into this safer spot, it's been so long now. How are the emotions? I know you've been through so many different iterations, from, if people haven't seen our previous conversations, between postponing your wedding, between having COVID, kind of run its, we think, through your household, and
oh yeah.
And as a therapist talking to folks as well. Now, where are you guys at emotionally? And I'm going to have you categorize the entire New York City area.
Actually, yeah. Well, I mean, yeah. So emotionally, I was kind of thrilled to finally cancel my wedding and not have that like hanging over as some kind of question of, am I going to make everybody get together and, try to have a happy time? And it's striking how, like, I'm a pretty risky, adventurous person, and how anxious I'll get if somebody isn't wearing their mask or has pulled it down, even if you're outside and they're kind of too close, like it can really affect you, especially having gone through, maybe having had it, and Dave having had it, canceling the wedding, like feeling and having friends who've had it, and then the deaths in New York, like you I don't know, I feel so much older than I did 3 months ago. I feel like 10 years has passed, but
I'm
I don't
with
know.
you
So
on that.
you're
I'm
asking
with you
about
on
like
that.
my emotions. I'm super emotional. I've been through like so many emotions in the last few months. And yeah, I mean, like now it's a question of schools and like, luckily our daughter's 2 and we don't have to send her to school. And I wouldn't want to. But I run into other parents that are concerned that their 3-year-old is going to have to wear a mask if they go to school. It's like, why are you concerned about masks? I just don't get the it makes no sense to start talking about how you can't get the oxygen you need, or then don't send your toddler to school. I mean, like, what is wrong with homeschooling? I'm sorry, I'm going off now on the
No,
whole
but I
school
think,
situation.
but I think the schools are in an interesting thing because that's the next. At first, it was just getting through the end of school for a lot of people and then getting everyone home. Then it was figuring out how we were going to get through summer and would we be able to go anywhere in the summer because that was people's normal pattern. Would we be able to go out? And now we're here we are with, do we send them back to school? And here in California, they just said if you're on a watch list, you start online learning, which actually took away a lot of the debates that were happening because those were heart-wrenching debates, like between people and in districts, and not and heart-wrenching may not be the right word, but certainly contentious and frustrating because everyone had definitely a position on that. Where's Italy in their schools in terms of, I mean, I guess, is everyone going back? Because I think I hear a lot of people here going, well, in Europe now they're like saying, well, can we do it if they're doing it in Europe? But they point to various studies. I saw a war of studies happening from from the Norway region versus the South Korea schools, and were there infections and were there not infections, and um, Italy, are you guys going back to normal in schools?
Well, they haven't said for sure, but the idea is that most probably, I mean, if things don't change in terms of the numbers, that kids will go back to school with as much outside learning as possible, with lots of screening of teachers and screening of kids, random testing, and also phasing of starting times. So for example, my son who's going into 10th grade, they've kind of said a heads up. They've said probably 10th grade is going to be Monday, Wednesday, Friday. Like they've started saying a few things to the effect of, he's in a school in the center of Rome, so they don't have an enormous campus. So chances are the whole high school won't be together all day, every day. So he might start later, start early. So they've given a little bit of a heads up in terms of that. But as for the government, they've said, school is starting as far as we know, if things don't change.
You mentioned testing. Let's switch to testing too, because how is testing in Rome specifically? You get a test. When do you get your results back?
I'm pretty sure it's immediate results. And they've started doing quite a bit of random testing, which they've found helps a lot because of all the asymptomatic cases, and because obviously the people who are going to get tested might also be the people who are pretty conservative and might not necessarily, not to say that they wouldn't have it, but that random testing and tracing are the two things that are going to be the most important in terms of like containing potential clusters. So there's a huge, out near IKEA outside of Rome, there's this huge, place where they're doing just thousands and thousands of tests. And then you can get tested randomly, at the dentist's office or the wherever. You can always say no, because in terms of privacy, you can refuse to be tested. But most people want to be tested to find out.
Wow.
I love that you just said
That's
IKEA.
amazing.
That's there's a difference though. Like I was just saying, I'm like, some of these results of the stories that we're hearing in California is that it takes, up to 2 weeks. People are still waiting and waiting and waiting. And so one of the issues with schools to connect them is that they said, if you cannot test the teachers and you cannot test the children in a timely fashion, then how do we go back? Because of what you're saying is timely contact tracing and testing is important. I mean, that's the big story in California, at least in the Bay Area too, of like, how long is this taking the supply chains? And I think this is a nationwide story, in terms of the tested situation. Anna, what is it in New York?
yeah, I mean, it's taking forever for tests to come back still. So yeah, it's a dismal, I don't
How's
know how much,
possible?
you know,
How is it possible that we have immediate tests and the US doesn't? I find that so hard to.
it's leadership, and it had to have been a priority of the government, of the Italian president, to make it a priority that people have tests for a deadly pandemic. Like, I
Well,
don't know how else would.
I think there are a lot of stories and people asking questions about supply chains and things going down. And so like there was a, I know that in the press conferences, at least the governor in California is holding it, it's about, we do have enough hospital space, we have enough ventilators. The testing is still something. And for a while we were upping testing capacity and it was getting better, but it certainly wasn't at the level where what you're describing is not something that I think people here even feel like is
Well, I think
on the
that the first,
horizon.
I think that the idea of testing and tracing has to come after you get to the point where there is so few cases that it's manageable. I mean, even Italy wouldn't be able to manage that kind of testing if the numbers were as high as they had been before. You know, after the super strict lockdown, there are, I don't want to say so few cases, but when you have less than 200 cases in a country of, 50 million or whatever, you can manage to trace and figure out where those cases are as best as you can. But it sounds like in the US, the numbers are so high because the serious lockdown never really happened.
Yeah, I think
Yeah,
I think that's exactly it, is that we have the chicken and the egg kind of situation now too, with how do you control it first and then how do you also do testing, and in some places we do have hospital capacity even though our numbers are higher, but what you're saying is, what happens is what if that changes, and where are we, and that becomes a very complicated situation, I think, and across the country. And then we have everything is highly political these days with, we have, the governor of Georgia suing, the mayor of Atlanta over masks. And so it has become, a different kind of world that we're living in, which is interesting and scary and crazy on all these levels. I'm wondering, we were talking about this earlier before we started this interview, in terms of how last time we talked, Katherine, we talked about how the questions people were asking you about the US. And now within the US, Anna, we have how we're all looking at each other from different states, which is kind of a new thing in terms of who we want to come visit our state and where we want to go and where we're allowed to go. I mean, if I wanted to come see you in New York, I would have to, wait 2 weeks before I even saw you. So I want to talk about impressions of where, I mean, how is New York looking at the rest of the country right now, Anna?
yeah, I think I'm scared of tourists, and yet that's such a huge part of our economy. I don't know. I mean, how.
I mean, are you getting the general sense that people even want anyone or to come into New York City? Obviously, New York City I mean, they can't unless they are quarantining. And so, but are people happy with that space of saying, yeah,
Yeah, I
we
mean,
finally got this under
I,
control. We don't need anyone coming in.
yeah, I guess. I mean, except that New York is so open, I mean, multicultural and so many people, and we kind of thrive off of just the people coming through. And I don't know. I mean, I don't, I had some friends travel in, I think, Montana, and they were afraid to wear their masks in places, like just afraid of what kind of violent reaction they would get for wearing a mask in somewhere. So I've seen a few confrontations about masks. That's sort of where things get. Of course, we're in a heat wave now too, so it's like a little bit like some kind of French existential novel on the playgrounds these days. People like just not really thinking straight and getting angry and not wanting to wear masks. But
Well, it is one of those places we're inconsistent, in terms of, and I think it confuses people from city to city, from county to county, what the requirements are. And if you're doing it because you're required to do it or doing it because you want to do it, it does change the experience in terms of saying, do I have to do this here? Do I have to do it there? Katherine, in Italy, is it just you have to do it everywhere? Whether or not people do it is the rule that you just have to wear masks if you're out?
Yeah, and it has there's no link with identity or ideology. Like that's the thing that's kind of shocking to me is that, and I think to most of the rest of the world about the US is like, how can a mask have anything to do with your identity or who you are or what you believe? It's just, it's something that has to do with the health of society. You know, I mean, it's such a different kind of thing that I think really only in the US and maybe some parts of the UK has it taken on this kind of significance.
Yeah.
Well, we also, I mean, not having a leader that believes in science, like there's no sense that there's a higher reason for anything. And so we just succumb to these conspiracy theories in America, and they're so dangerous and they're so, I don't know, believable that they look so real, I guess, online, and
Well,
I think that's one of the big problems of.
that sounds right. And I think that it's not America per se, but in a way, the US is ahead of Europe in terms of social media and in terms of, I mean, we still watch the news. Like all of Italy watches the news in the evening and it's one news. You know, it's the news
Wow.
of Rai Uno. And in the lockdown, they would tell us the number of new infections, the number of deaths, where they were, what needed to be done, what the curve looked like, and everybody was getting exactly the same information. And so what I'm seeing, for example, is that in the US, where everybody's getting their information in different places, it's a whole different thing. And I see it with my teenagers who are on Instagram or they're on TikTok or whatever, and they're sending me videos and saying, hey mom, what about this? And I'm thinking, but this has nothing to do with the news. You know, I mean, this is, but I think in other countries, maybe in countries that are quote unquote more advanced technologically, people are getting even in the same family news from different places.
That is the case. We have many different news sources, kind of, good and bad, obviously, in our space.
Yeah.
And as Ted Koppel likes to say, it's never been harder to convince the American public of something they weren't already inclined to believe. So whatever you believe, you can find something that backs up that stance, as opposed to finding, a place where you might hear both sides. You get your proteins and your vegetables on the same plate, kind of thing, where you didn't
I like the
you didn't
idea
want all of it.
You check it out with 4 different trusted news sites. Like if you hear something that not sure sounds maybe true, looks true, still check it out at 4 different trusted sites.
Right. I think we
Maybe
have a lot of
would help.
information, but I think, I talk to students in college, and I'm like, you guys are lazy. We used to be, because it used to be that you could just watch one, your big 3 at the, when I was in college, right? The big 3, and you'd watch them, and you'd kind of watch, the Jennings, the Brokaw, the Rather, and you just kind of, that was your 3 sources. And then you'd read the paper in the morning, and now you can go to all these different sites, and you can look up, all their backgrounds, and what, people, how even their trustworthiness, but it does require a lot of more work, and you do have to work.
I heard there's a media bias chart that kind of shows where medias are on the
I do.
left,
I bring
right
that
spectrum.
up all the time when I talk to
Good.
And things
Yeah.
like that. And it's good to know. I said, everyone actually, it's just good to see, where you're getting your food from in terms of news and sourcing and all that. And it becomes a but again, it takes some work, and it takes some thought to kind of go through all those sources. I think it benefits us if we do that. I guess, so now how are we all feeling? Like, I got to tell you, in California, I'm feeling I struggle a little bit with feeling positive in a way that I had those positive feelings earlier. It sounds like, Katherine, you're in the best situation, kind of feeling like you're surrounded by more growth and trending in the right direction, and Anna kind of in the middle. Like that's where we've all kind of rotated to.
I think but I think it's important to remember that, you know, it will end, you know, I mean, it won't be forever, and things will go back to, you know, not exactly the same, but things will go back to freedom and, you know, living our lives with some sort of normalcy, because it did seem impossible for us as well. I mean, it was, you know, during the lockdown, it seemed impossible that you know, that this kind of life. I mean, I dropped my son off at the airport yesterday because he went to Croatia. He's going to Croatia for the summer. And, you know, it was a lot less people in the airport, but, you know, it was, people are traveling, people are doing things, and that'll come in the US. It just might take a little while. And it was awfully sad. It was, I told my sister, I didn't think I would, but I started crying because I walked into the Rome airport, and, you know, there are all the Europe flights, and I'm like, okay, you've got your boarding pass, this, that, and the other. And then I looked to Terminal 3, which is where all of the US flights are, and it's completely boarded up, and there wasn't a soul, because obviously nobody can come in or go to the US. And I just looked at it, and it was just so surreal that I burst into tears.
Yeah, I can't imagine. I mean, that's usually a very busy spot. And believe me, there's many people here who would like that terminal to to reopen, you know, safely, of course. But, you know, I mean, I think as summer comes and wraps around to the end, I think obviously Europe was a hot destination, you know, in the summer months for US travelers. And I think for it to come to an end and people to say it's not going to happen, and to recognize that travel is not going to happen, is a sobering one. And even, I mean, New York City, this is where I was last summer. You know, that was where I, you know, vacationed, and it was amazing. But, you know, if I look at my pictures crowded in with people going to the theater, like, it feels like 157 years ago that we lived that life.
Doesn't it? Yeah.
It's a crazy thing. Well, if anything I've learned from our conversations is that as much as we try to predict, we we end up here in a new conversation with a new world, and many things that we did not predict. So I am hopeful that we get a conversation again soon that has all these positive things that we didn't maybe see coming. So let's let's put that on the vision board.
Yes.
Definitely.
And in the interim, you guys stay safe and stay healthy. And I appreciate, as always, the chat.
You too, Claudine.
All right. And for more interviews, you can, of course, go to coronavirusnow.com. Thanks so much for joining us.